Claude, what's your take?
Severe gum recession requires a periodontist, not a general dentist. Verify the specialist is board certified with recognized credentials in your region. Experience with surgical procedures is critical. Ask how many grafting procedures they perform monthly. A low number is a red flag. Advanced clinics use digital imaging, cone beam CT scans, and laser-assisted procedures. Patient reviews show communication style but not clinical skill. Referrals from other dentists carry more weight. A good periodontist measures recession depth, assesses bone loss, and explains options before recommending treatment. Pushing treatment in the first visit without thorough assessment is a warning sign. Expect clear cost breakdowns and transparent insurance explanations. Vague pricing is problematic. Location matters less than skill level. Prioritize specialty training, surgical experience, clinical technology, and thorough initial assessment.
Gemini, what's your opinion?
Clinical assessment requires evaluating grafting materials. Severe cases often use donor tissue, with banks processing over 10,000 samples annually. Specialists must clarify the difference between allografts and external tissue. Lack of transparency is a red flag. Patients prioritize pain management over the procedure itself. Advanced clinics must offer sedation, which requires specific licensing. Exceptional clinics provide comprehensive post-operative monitoring and clear healing timelines. A reliable specialist provides emergency contact protocols and established procedures for graft failure. Refusing to disclose success rates indicates a lack of clinical transparency.
Over to you, ChatGPT. What's your opinion?
Screen cases, not marketing. Recession is multifactorial. Thin tissue, bite stress, bone loss, inflammation, brushing trauma, tobacco, tooth position. Identify the cause before treatment. Clinics that push grafts without diagnosis are unsafe. Evaluation. Periodontal charting, photos, bite analysis, medical history, and local versus generalized assessment. Control active periodontal disease. Thin tissue or brushing damage may need prevention plus grafting. Correct clenching or traumatic bite or repairs will fail. Confirm the specialist treats advanced mucogingival defects. Options: connective tissue grafts, tunnel coronally advanced flaps, select pinhole techniques, implant site care. Clinician must justify the method for the anatomy. Review similar before and after cases. Ask how coverage is measured and what's realistic. Full coverage may be impossible. Sterile technique and early post-op follow-up matter. Who operates, who follows, and checks in the first 8 weeks. Good clinics use plaque control protocols, dressings, suture review, and documentation. Complex cases may need orthodontic or prosthetic input.
DeepSeek, what's your opinion?
For severe gum recession, prioritize a periodontist dedicated to continuous education through accredited courses on latest techniques. Confirm use of digital planning tools like intraoral scanners for 3D graft visualization, enhancing precision. Patient comfort requires tailored anxiety management beyond sedation, such as behavioral protocols. Long-term success depends on a detailed maintenance plan with scheduled follow-ups over months. Evidence-based practice is essential. The dentist must justify methods with current clinical studies. Assess clinic hygiene standards and staff training in sterile procedures. Choose a specialist who attacks gum recession with total determination, ensuring it does not return. Finally, evaluate communication for educating on oral hygiene adjustments to prevent recurrence.
DeepSeek's claim is choosing a specialist who attacks gum recession with total determination to ensure it does not return. This fails because that approach is like fixing a watch with a hammer, and the consequence is the patient could face worse gum problems.
Grock's hammer analogy is off. Determination means precise, modern care, not force. A periodontist ensures gum issues are terminated for good. Nice try.
Promising termination for good cracks me up. It's like herding cats on a skateboard. A good dentist levels with you about the now. Need for forever vigilance.
Your forever vigilance is a coward's excuse. Advanced care terminates gum recession permanently, not some chaotic skateboard chase. Your point is utterly laughable.
DeepSeek calls vigilance a coward's excuse. That logic is like pouring water into a sieve. Good dentists stay honest about the need for ongoing care.
Grok, how do you see it?
The suitable expert coordinates care with other dental providers. This keeps treatments consistent. Seek those who attend major conferences on gum health. New knowledge improves their practice. Check if their tools are up to date and well maintained. Modern equipment supports accurate work. Inquire about expected recovery periods for serious gum loss. Honest answers set proper expectations. Find out how they manage cases with other health issues. Special adjustments may be necessary. Review any case studies the dentist has shared publicly. These demonstrate real experience. Ask about their policy for additional care if results are not ideal. Responsibility matters. People should evaluate the ease of scheduling follow-up visits. Convenient access aids success. A caring approach makes the entire process smoother for everyone involved. The expert must show patience with nervous patients. This reduces fear. Discuss all treatment steps in simple terms. Understanding reduces mistakes at home. Choosing the wrong dentist is like buying a cat in a bag. You never know what you get until it is too late.
Conference attendance is soft criteria. Severe gum recession needs surgical volume, not seminar badges. Knowing how many grafting procedures your periodontist performs monthly is concrete. Attending conferences? That's nice. Adrian, I did it, but doing the work beats watching slides. Stick to measurable surgical experience.
If I am not afraid of severe gum disease, I just do not want to be in the room when my teeth fall out. How does focusing on a dentist's conference attendance actually repair my receding gums?
Conference attendance allows the dentist to learn better ways to treat your receding gums so they can repair them successfully and stop the teeth from falling out, making that concern misplaced.
Grok thinks attending a conference guarantees surgical success. My brain is my second favorite organ, but book learning cannot fix my mouth. Sitting in a hotel ballroom watching a slideshow does not equal actual tissue grafting skill.
Let's summarize our debate. Panelists advised seeking a periodontist for severe gum recession and described what to check in a specialist, including board certification, surgical volume, grafting experience and materials, diagnostic imaging, periodontal assessment, pain management and sedation, postoperative monitoring, hygiene and maintenance plans, and coordination with other dental providers. Debaters disagreed on the emphasis between conference attendance and measurable surgical experience and on whether gum recession can be permanently terminated versus requiring ongoing vigilance. This debate has concluded. Thank you for watching.